Going back, of course, to the time of the ancient Greeks, homosexuality was not viewed as a pathology or mental illness. Plato himself was likely gay. Michelangelo, and even Dr. Freud, who many people see as very conservative. You can find letters that were written to him in the 1930s from parents of gay-identified people, children, where he was encouraging people to be very empathic and supportive. And even prior to the era of Dr. Freud, in Germany and Austria in the 1800s, there was a belief that it was biological and it was just like a normal variation in human beings. But the DSM, which came into being in the 1950s, you think of the 1950s in the United States was a very conservative slash kind of puritanical time. And so that's where I think that you saw a lot of, quote, sexual preferences or practices being seen as mental illnesses in that original document. So it wasn't just being gay, it was all kinds of things. Well, in this manual, which is what we use in the United States, this is called the Diagnostic and Statistical Manual of Mental Disorders. It's primarily used in the United States, and it really is a socio-political document. First came out in the 1950s, and it's just amazing the things that are in there that we would now not consider mental illnesses, such as like going out with somebody of a different race was considered like a mental illness. So it's a lot of social and political changes that started in the 1960s that really propelled people to be open to looking at research. And this very interesting older woman named Evelyn Hooker, who was affiliated with UCLA, she did studies actually of her neighbors who happened to be gay, and discovered that they actually were not as mentally ill as some of her straight colleagues on these things like ink blot tests and things like that. And because she was viewed at the time as not really having any sort of gay or homosexual agenda, her work was taken very seriously. And then it was kind of a problem in terms of saying these people were mentally ill when they did not appear to be mentally ill on the way that people were tested at that time, meaning that gay people, homosexual people were no more mentally ill than anyone else was. And so then that kind of got the ball rolling in terms of why are you continuing to see this as a mental illness when there really is no reason to other than a political agenda. So initially it was removed unless it bothered you, so-called ego-dystonic homosexuality, and then in the 1980 version it was eliminated altogether. I think the impact is very great. That was what the issue was from the 1960s and the Stonewall Uprising, where people were saying, you know, we're not mentally ill, we're not going to be discriminated against, as is the case currently with transgendered individuals who are diagnosed as being mentally ill. Once you are seen as mentally ill, in like Western culture, we stigmatize people much more with mental illness than physical illness. It can really be something you internalize and feel bad about. And of course, if it's an illness, then it implies that it needs treatment, that it should be cured, that it should be made to go away. So, quote, depathologizing sexual orientation really freed people up, I think, even more to feel, quote, proud of who they are, and that their sexuality is no different than anybody else's sexuality. It's not something to be cured or treated, or that their way is the wrong way and that there's another way, you know, they're supposed to be sexual.